the external iliac artery will become the femoral artery, and it does that when it passes underneath the inguinal ligament. Inguinal ligament connects our anterior superior iliac spine to our pubic tubercle. So the inguinal ligament would be roughly right about here. So here we would have external iliac, here we would have femoral artery. The femoral artery passes initially in the anterior thigh and then works its way to the medial side of the thigh and then passes through a structure known as the adductor hiatus to go posterior to the knee. When this femoral artery passes through the adductor hiatus, its name changes. It will then become the popliteal artery. So femoral starts in anterior thigh, works its way to medial thigh, through adductor hiatus, goes posterior to the knee. At that point it becomes the popliteal artery. Now there was a lot of things happening at this femoral artery when we first entered into the thigh. At the level of the pectineus muscle, we have three things happening. We have a branch coming off of the femoral artery and diving deep into the muscles of the thigh. It is called the Profunda Femoris artery, also known as the deep femoral artery. And we can see it passing here, and we know this is the Profunda Femoris because it has perforating branches that will disappear behind the femur. So we can see one here, another one here, and another one here, disappearing behind the femur. So this is our Profunda Femoris artery with its perforating branches. The other vessels that branched from the femoral artery at this level are the medial and lateral circumflex femoral arteries. Now, I said from the femoral artery, they may branch from the initial portion of the Profunda Femoris, but we're going to say from the femoral in this case. Now, this plaque does not show the medial circumflex femoral artery on this left lower extremity. It does show the lateral, and I know this is the lateral femoral circumflex because it passes anterior to the femur. And here we can see its ascending branch and its descending branch. There is a third branch that is not depicted. There should be a branch going to the medial side and then behind the femur. That would be the medial circumflex femoral artery, not depicted on this model. Now if we hop over to the other side, we can see a little bit of that. We can see the femoral artery coming in, then they've cut a piece out so we can see what's going on. Here we can see part of the lateral femoral circumflex, maybe medial femoral circumflex here, and we can see a pudendal artery here, but I do not believe you'll be responsible for pudendal artery. And then we can see the femoral artery as it passes down and it goes posterior to the knee where it would be popliteal artery, and we see a branch here. Maybe, depending on whose course you're in, you may need to know this branch. This is called the Saphenous artery. It comes into the femoral artery, or actually comes off of the femoral artery, and goes to the lateral, or excuse me, the medial aspect of the knee. Hopping back over to the left lower extremity, notice on this left lower extremity we've rotated it, we've done a lateral rotation of this extremity, so we're looking at the medial side of this lower extremity. We've seen that as we went behind the knee, the femoral artery changed its name to popliteal artery, that the popliteal artery stops being popliteal when it branches into an anterior tibial artery and a posterior tibial artery. On this plaque we can see the anterior tibial artery passing lateral to the tibia and then running in the anterior leg as anterior tibial artery and then out onto the top of the foot as the dorsalis pedis artery. We can follow the posterior tibial artery as it goes behind the medial malleolus of the ankle and becomes the medial and lateral plantar arteries. Because we've rotated this lower extremity, we're looking at the medial aspect of the foot, so this must be a medial plantar artery. Now there should be another vessel branching in here known as the fibular artery or peroneal artery. It is not depicted on this particular model. Now on the other side, it's much like the other plaque. We lose things at the knee. There's a lot of anastomosis going on at the knee. These vessels do have names. You will not be held responsible for them. But here we can see that anterior tibial artery running down the anterior aspect of the leg and out onto the dorsum of the foot to become the dorsalis pedis artery. The veins in the lower extremity have the same names as the arteries, So the arteries were going out, the veins were coming back, and by and large they have the same names with the exception of the small saphenous vein and the great saphenous vein. And on this plaque we have a really good view of the great saphenous vein. It begins on the medial aspect of the ankle and ascends the medial aspect of the leg, the medial aspect of the thigh, where it will dump into the femoral vein just before it becomes the external iliac vein. So this is our great saphenous vein. This was our femoral vein that on this model has been cut off. We pass underneath the inguinal ligament, we become the external iliac vein. Right and left external iliac veins. Coming out of the pelvis, we have the right and left internal iliac veins. Internal iliac veins and external iliac veins unite to form common iliac veins. The common iliac veins unite to form the inferior vena cava.